Hey guys, it's Christina. Today we're going to talk about proper wound care. Some of you guys might not know because you may not have been into the hospital before. They don't send you home with anything to provide proper wound care. That's why we have this bucket. We're going to go over what's inside of it today. So you can see the bucket here has a sticker and it tells you everything that's on the outside. It tells you what's inside the bucket. Now over here, these are add-ons. So you can add these on and they go into the bucket once we build it for you. So whenever you pull this out here, immediately you have a big old bag full of 4x4s. So by this time, you have already been to a higher level of care. They've already treated your wound, they've debrided it, cleaned all that yucky stuff out of it. You have to now take care of it yourself at home. Then you have some ABD pads. So these are abdominal pads. They're really thick and they work really, really good on your abdomen if you have a wound. You can use them in other places. You just not specific just for your abdomen. So you also have a bigger abdominal pad. You're gonna see here, these are 5x9s and these are 8x10s. So they are bigger. Then we're gonna have some rolled gauze. You have two different sizes. You have the big ones here and then you have the smaller ones, and all it is just rolled gauze. So let's say you have a wound on your arm and you need to rewrap it. You can put your gauze, say a 4x4 right here, and then wrap it with your rolled gauze to keep it in place. You're also gonna have your 3x3s. It's pretty easy, 4x4, 3x3, right? And then you have a big old huge box of Band-Aids. It is assorted Band-Aids, so there's several different sizes in here for you. You're gonna have a big full bottle of hydrogen peroxide, a full bottle of rubbing alcohol. Remember, if it's wet and sticky, don't touch it. Put your gloves on, because you want your gloves on to make sure that you don't get any nasty germs from your hands into the wound. So put your gloves on before you touch it. Then you have some 2x2s, a little bit smaller. So if you don't need a full big 4x4, you can use a 2x2 or a 3x3. You're gonna have 2 bottles here of iodine. So if you need to clean the wound or anything before you bandage it, so you can clean it with your hydrogen peroxide or your rubbing alcohol and then put your iodine on it to help kind of keep it sterile. And then your last but not least is your tape to hold your dressings in place. And there's also triple antibiotic ointment in here to put that on top of it as well before you dress it, because you want to make sure that you put some kind of healing agent on it before you wrap it. So the reason we need all this gauze is because you need to change your dressing regularly. You can't just have it dressed and then forget about it. It's not a set it and forget it kind of thing. So you want to change it regularly, every couple of hours, 4 to 6 hours. It just really all depends on what kind of wound you have. So now we're gonna go into the extras, the add-ons. This is our suture kit. This has more gauze. It's got all of your sutures. It does have hemostats in here. You've got iodine prep pads. It's a really, really cool looking bag. So then you have your sharps container for your scalpels that's in here, and then your suture needles as well. You can't forget the shears, remember? Because you're going to want to cut off the trauma dressing patch that the hospital has put on there. And then let's say you've rolled your arm or something with your rolled gauze, you want to just kind of cut it off instead of just taking the time to unwrap it. Then you have your MSK, which is your military surgical instrument kit. You open it up here and it's got all your little instruments that you might possibly need. You might not need everything for every single wound, but this is such a really cool kit. And last but not least, you have your burn shield dressings. So let's say you have a 3rd degree burn, they're going to want you to keep these burn dressings on there. Always, always, always follow the directions of the hospital. If they don't tell you to put it on there, don't put it on there. But if they do, you're going to want to have these. That's all we have for today. And check out Refuge Medical. And if you like our content, give us a like, a share, and a follow.